Good morning. Um, my name is Sakiko Fukuda-Parr, and I'm co-lead the collective on the political determinants of health together with Katerini Stirring. And I'm here this morning with Alicia Yamin, Joe Harris, and Sanya Reid Smith to talk about the consequences and the implications for the latest change in the policy environment of global health, with essentially the United States withdrawing the from multilateral action. We have here today a conversation that will explore the implications in terms of what the responses might be for those of us who are committed to promoting health equity, global governance for health, and addressing the political determinants of inequities, and explore how it is that we can build alliances in this new world. So let me start by introducing very briefly the speakers who are, I think, well known to many of you. Alicia Yamin is based at law school at Harvard. But she has been long a advocate of human rights in health, particularly in issues related to maternal health, but beyond, looking particularly at global governance structures, international financial architecture, and so forth. More recently, well, not so recently, perhaps. Sorry, Joe Harris is a professor at University of Boston in Boston, Massachusetts, USA, who has been very good, very invested in studying the diplomacy, politics, particularly of Thailand, in promoting universal health coverage and beyond. And Sanya has long been with the Third World Network, as an analyst, as a researcher, as an advocate, particularly in areas such as intellectual property and other areas of trade and international legal norms and health. So this conversation will be an informal affair with each of the speakers giving a very short informal introduction about their the ideas that they have about the situation that the new political environment is creating, and in response. And I think what we'll do is we'll start with Ali and Joe, who have actually already written blogs, and they can briefly talk to their blogs, where they made very important points about, in a sense, not overreacting. And I want to, but we're also very privileged to have speakers who are situated in different parts of the world, in different contexts. So I hope that we might benefit from those varying perspectives. So I want to start with Ali by asking her to please talk about, first of all, put us on the same page by recalling not just what the new administration has done, what President Trump has done, but updating us as to the initial evolution of the situation, but then moving on to talk about some of the points that you make in your blog and beyond. You don't have to stick to those to your blog either. So over to you, Alicia.
Well, thank you, Sakiko. And it's really a pleasure to be able to have a conversation with people who are alarmed and thinking about these issues. So I'm very much looking forward to hearing others' perspectives as well. I think in the few minutes that I have, I want to give a little bit of context for what is happening now, as Sakiko said, then step back a little bit and think about how we can understand what is happening as advocates for global health equity. And then if I have time to suggest some movement forward, and if not, that'll come up in the Q&A. So for people who don't live in the United States and don't follow this, the first thing to say is that the United States is not generous in terms of foreign assistance. We don't come anywhere near the 0.7% of GNI. We spend approximately 0.22% of GNI on foreign assistance. And if you look at health in particular, that's difficult to measure, but it would be about 0.05% of GNI. But because the United States is so huge and hegemonic, that has enormous, enormous consequences. So estimates are that approximately $60 billion have been made in total cuts to foreign assistance and approximately $8.6 billion in cuts to ODA to health. Again, not totally clear, so you shouldn't quote me on those exact numbers. But there are also, of course, mass layoffs. So 10,000 staff contracts have also been cut. And the economic cuts are not the only thing that's happened, right? The Trump administration has reinstated the large version of the global gag rule. So NGOs, recipients of aid money from the United States, cannot receive other money from other sources in which they use to even talk about abortion services, for example. They've been made to sign what's called the Geneva Consensus Declaration, which is really an anti-abortion, anti-LGBTQ screed and violates domestic law in many of the countries that are forced to sign on to this in order to receive assistance. So what does that mean? Let's look at a region where I used to live for years, East Africa, in terms of USODA. As a share, USODA as a share of domestic government health expenditure in Tanzania, where I lived for years, is 72%. In Mozambique, it actually exceeds domestic health expenditure. It's 101%. In Uganda, it's 102%. In Malawi, it's 233%. So that obviously has enormous impacts on those health systems. And even though life-saving commodities have rightly gotten a huge amount of attention, this is also gutting the staffing, the infrastructure of health systems in countries that are already incredibly underserved and stretched. Other countries in the region, such as Kenya, which is a much wealthier middle-income country, still highly indebted, but it's also deeply affected by these other adjacent policies like the Global Gag Rule and the Geneva Consensus Declaration. Commodities, of course, are tremendously important. There's a lot of fuzziness, and this chaos and uncertainty is part of what's going on. Fuzziness around the humanitarian waivers, because in country, despite the waivers, we are told that they are in effect, people are still not getting those commodities. And looking forward, it's now unlikely that programs like PEPFAR that have supported 20 million people with HIV across 55 countries will be reauthorized even by the Trump administration. So a third final thing I'd like to point out is data and information, which is the lifeblood of global health. You may have heard about the data being taken down from CDC and NIH websites. Studies that were approved are not getting contracts from the NIH. Research is under threat from the cutting of so-called indirect costs, which is the bizarre way we fund scientific research in this country. And all health equity research is deemed to be not in US national interests. And there's an enormous conflation between what they call DEI, diversity, equity, and inclusion, which is really kind of a human resources policy, with all of health equity, any kind of health research that affects marginalized or disadvantaged communities, right? The US also supports a lot of surveillance and data collection around the world. You know, the Gremlins program is quite famous, for example. It supports more than 700 international labs that test patient samples for things like COVID, RSV, dengue, yellow fever, Ebola, which it does for a pittance, relatively, $8 million a year. Totally cut the funding for that. And of course, we withdrew from the World Health Organization, which will severely impair our ability to collaborate, to share surveillance. Bottom line, we are in a worse position now to deal with a serious pandemic than we were 5 years ago when SARS-CoV-2 broke out. And it should be noted that we are in the middle of an outbreak of avian flu, as well as an outbreak of measles in this country. So stepping back a little, how do we understand what is going on here? You know, I, along with many other people on this webinar and in the Political Determinants Collective, have for a very long time been extremely critical of global health as fundamentally colonialist in how power operates, which affects outcomes, agenda setting, knowledge creation, and more. I've also argued, as have many others, that global health is a terrain on which neoliberal globalization has played out with very, very stark effects as political economies shifted and economic power became ever more concentrated in the hands of powerful private actors from the economic north, many in the US that are largely entirely unaccountable. And as we all know, health is a very acute reflection of inequalities and injustice within and between countries, as was so dramatically shown during the debacle with COVID-19. The US has played a huge role in constructing the global order that systematically perpetuated such gross inequities. We know that because of illicit financial flows and many other factors, the global south is actually a net creditor to the economic north, not the other way around, to the tune of trillions a year. Jason Hicklesworth on Unequal Terms of Exchange has shown that appropriation of labor and resources from the global south outstrip assistance by a factor of 30 to 1. There are 3.3 billion people now living in countries that spend more on debt servicing than health. So I do not share some of my US colleagues, and I'm not putting Joe in this basket, the admonitions that we need to somehow seek to recuperate US leadership in this space, and that getting the Democrats into office is the best way of doing so. I think now is the time that we need to address those root causes and systemic issues. If not now, when, right? Critical theorists tell us that hegemony is not broken from the outside in, as domination can be attacked, but is inverted from the inside out. Donald J. Trump has just broken through the hegemonic structure of global health governance. So, for example, some of the countries I just mentioned in terms of money from US ODA versus US government expenditure, debt servicing outstrips government health spending by even greater amounts. Tanzania spends 231% of what government spending on health is. Mozambique, 138%. Uganda, 376%. Malawi, 486%. We need, without the assistance from the United States and others are pulling back too now. Great Britain has just announced that it's pulling back from aid to spend more on defense, again, as a result of the cascading impacts of Trump's policy changes. So we need immediate relief in terms of special drawing rights and debt moratoria. We've talked a lot in the past about debtors' clubs, but this is a Jubilee year, and the powers that be are unlikely to offer debt suspension initiatives as they did during COVID briefly. So we need to organize middle income countries. I'm hopeful that middle income countries like Brazil are thinking about that, South Africa, to collectively stand up and say there is just no way that we can exsanguinate with this debt payment at the same time as all of our foreign assistance has been cut off. And I will stop there. I think I've gone over my time, but I have other ideas about tax and some other things. Thank you.
Thank you, Alicia. Those wonderful comments. I wish we didn't have to make them, but here we are. So I first want to thank Sakiko for reaching out and organizing this important conversation. I wish we didn't have to do it once again, but if we do, I'm very glad to be having this conversation with you all. My name is Joe Harris. I'm an associate professor of sociology at Boston University, and my work is on the politics of healthcare access, also infectious disease response and global governance. And I was asked to speak on the role of global health professionals, both inside and outside of government, and what role they can play in pushing back against what's going on right now. By way of background, my book, Achieving Access, Professional Movements and Politics of Health Universalism, explores the role that professional movements can play in developing policies that expand healthcare and medicine benefits to the broader populace. And I explore those movements in Thailand, in Brazil, and in South Africa. And in contrast to times where private interests capture regulatory institutions, I discuss moments where movements of elites from esteemed professions employ strategies that result in what I call developmental capture, that lead to new policies that are created a benefit to the broader populace rather than narrow corporate interest private gain. Now, while those stories of professionals in those countries are inspiring and speak to important changes within nations, within those nations, today the world is facing an altogether different challenge. And the decisions of this new political administration have imperiled global health quite literally. As Alicia stated, the U.S. has left the WHO. Aid is being cut around the world dramatically, not just by the U.S. government, but through these cascading effects. People who have committed their lives to helping improve the world and the lives of people around it are being fired in the U.S. And around the world without regard to the work that they do. Funding to U.S. government assistance that's provided a critical lifeline to people who, for example, lacked access to medicine that turned a once fatal illness in HIV/AIDS into a chronic disease are receiving news today that they will no longer have access to that, condemning them to a death sentence. Government institutions that took a long time to build are being undermined in a matter of weeks. Officials at the CDC are being silenced, with research being stopped, retractions being required on papers relating to a range of terms. Research funding is being cut, threatening treasured institutions of higher learning, with those attacks just beginning. Public data sets are being erased. Work with any reference to diversity, equity, or inclusion is not only being ended, but websites are being set up that actually ask people to report on other people who do work in those areas. In areas like the social determinants of health, which is core to all that we study. The U.S. and the U.S. government, as Alicia, mentioned, is and was never perfect. Its policies were and sometimes are the cause of great problems and calamity around the world, just as at times they have been the source of a great many good and positive things. But the world we are living in today, 5 weeks in, just 5 weeks into this new administration, is a world turning upside down. Now, in this moment, just as we did during COVID, it's really easy to be consumed by this noise, to doom scroll, waiting for the latest awful news to drop, and to feel disappointed, alone, and disempowered. But there are things that we as global health professionals can do. There is strength in community, in working together, and in organizing. Professionals and the professional bodies and associations they are a part of, like this one, can issue statements based on their expertise that show and highlight the consequences of misguided policies. They can organize petition drives and deliver those petitions to policymakers. Professionals can appeal to moderate lawmakers who are open to understanding the consequences that these policies will reap, uh, and also translate some of the confusing and complex developments going on into accessible, understandable pieces that help the general public make sense of what's going on so that they understand why they should be alarmed and how these changes will affect them. Not only can we make these pieces available in the media, but we can also seek to move people to action right in our own social networks. And I just got back from Louisiana, my home state, and went to visit my sleepy little hometown. And it was wonderful to be there, but I also realized what is happening that I am seeing is not something that they are aware of. And so we need to reach deep into our networks and help people understand. We can take part in mass mobilizations, including those taking place on the streets of cities around the U.S. today. I'm here in Chicago today at the International Studies Association meetings. I was part of the Global Health Studies section there. Today, here in Chicago, there is a march, a protest on here on March 4th in support of democracy and democratic institutions, and there will be many others. Global health professionals in the U.S. can call their congressman each day and attend town halls of congressmen to make their voices heard. We can offer our expertise to the courts in the form of amicus briefs on cases that pertain to public health. Global health professionals in other countries can encourage government officials and business leaders to help their counterparts in the U.S. see value in regulations that are being torn down that protect the public health, and also global health. And we can use our centers, our institutes, our conferences, and our other platforms to create new conversations, to platform issues that give voice to these and other important issues. And new issues will emerge, to be sure. This is a moment where we must all do what we can to limit damage to global health, to alliances, to knowledge repositories, and to governance institutions. We all have relationships with others and therefore roles to play. As Alicia mentioned, it's also time to begin conversations about filling critical gaps in global health and aid programs that have suddenly stopped. Some high income governments, countries have funding capacity. And countries like Brazil, India, Thailand produce generic medication, including life-saving HIV/AIDS drugs. They're interesting and important conversations to be had here. And soon it will be time to begin broader conversations about how best to fill this vacuum in leadership in global health. And this we may think of as an opportunity to take steps to create a new and more equitable global health order that is grounded in justice and takes to heart lessons of the decolonized global health movement and which shows the world a better way. This is time for supporting one another, for putting fire underneath the feet of our politicians, but also for embarking on these important new conversations. It is a scary and uncertain moment, and a great many bad things will happen because of these many reckless and irresponsible decisions. But there are nonetheless opportunities to define the world in new ways as active members of our communities, embedded in networks that span the world, with deep expertise on issues that matter, with different resources, skills, knowledge to bring to bear on problems and challenges the world has to face. I'll stop there, but I look forward to the conversation that follows. Thank you. I believe it's Sanya next. Is that right?
It's actually Paulo, because
Oh,
Paulo's
Paulo,
here with us
please.
from Fiocruz.
Great.
Okay, thanks so much. My name is Paulo Buss. I'm Professor Emeritus at the Oswaldo Cruz Foundation, that is a public institution with 155 years of existence, the NIH of Brazil, linked to the Ministry of Health. And at Fiocruz, I'm director of the WHO PAHO Collaborative Center on Global Health Diplomacy and South-South Cooperation at Fiocruz. And I'm currently president of the Latin American Global Health Association. Well, we all know that in the first week of his second term, the US President Donald Trump has thrown the country's scientific apparatus into chaos, while at the same time anointing a new tech oligarchy. This is our vision from Latin America about the new president. And with a blitz of executive orders, he set the US on a path that will derail climate goals, biomedical research, pandemic readiness, and only God knows the next. This statement, without a doubt, the US withdraw from the WHO will have a substantial impact on global health. Not only due to the reduction in funding of the organization and the withdrawal of US staff, who are technical staff assigned to support the work of the WHO, both in the headquarters in Geneva and at WHO offices in regions such as Africa, or in countries such as Mozambique and others that I know very well because we have been working with the Portuguese-speaking countries for many years. And Mozambique, Angola, etc., are countries that have been supported by PEPFAR since 10 years ago. And the impacts of global health will also come from the suspension of technical and humanitarian aid provided by the US aid to several countries and institutions around the world. And I could give an example by mentioning again Mozambique, where approximately 19% of its population is infected with HIV/AIDS, as you know, and patients in Mozambique are totally dependent on PEPFAR, which has suspended support for medication and monitoring, with no plans to resume support activities. I have been calling to and from the people, our friends and in Mozambique. This will come about through the reduction of funding and partnership in research between the NIH, American universities, and scientific institutions around the world in the biomedical and health areas in general. And Fiocruz, one of the most important biomedical, clinical, and public health research institutes in Latin America, and also very important globally, has already started to have its funding suspended and will have to justify certain studies, mainly in sexual and reproductive health, stem cells, genetics, gender and HIV/AIDS, and many others. There will also be a major impact due to the withdrawal of the US CDC from global disease control actions, identification of pathogens in epidemics, etc. And CDC, US CDC, is quite important in this field. And the Brazilian Ministry of Health has already begun to experience difficulties in the technical cooperation it had with the CDC to control dengue fever, malaria, HIV/AIDS, and other diseases. Also, the US withdrawal from the Paris Agreement and the huge cuts in staff and funding for the EPA, the Environmental Protection Agency in the United States, will have a global impact on the control of vector-borne diseases that have expanded with climate change, in addition to the direct effects on food production, droughts, floods, and many other so-called natural disasters. Trump also ordered a review of the US relations with each and every agency, fund, and program of the United Nations, and will only maintain those that, in quotation marks, help the United States become safer, stronger, and more prosperous. Incredible, no? This could lead to the withdrawal of support for UNESCO, UNFPA, UNICEF, UN Women, and others that deal with issues that are determinants of health. And these UN bodies provide substantial support to Latin American countries. And the cuts with the reduction or suspension of US resources and technical professionals will reduce this support. Latin America, and particularly Central America and the Caribbean, are suffering the new impact of the new xenophobic immigration policy of the United States. There has been a substantial reduction in the resources sent by immigrants from these countries who are in the United States to their families, which is causing an economic crisis for the acquisition of food, medicine, and essential services by these families dependent on the money sent. So this is a terrible situation currently in Central America, mainly in Central America. And the deportations of immigrants mean that a significant number are being forcibly returned on flights and putting pressure on the already fragile social policies of the countries that received them back. We cannot forget, in the case of deportations, what has been called by experts silent trauma, the effects on the mental health of deportees and their families without the countries that receive them back being able to treat these effects. Therefore, the perverse effects of Trump's political guidelines on the various dimensions of social life and on the foreign policy of the United States are, in my opinion, brutal, merciless, inhuman, and will cause irreparable damage both to the health of the victims and to the world's view about the United States. I still cannot fully assess the perception of the American Congress and, above all, the American population regarding the damage that Trump is causing to the American people and to the country's prestige as a cradle of humanitarian aid since the World War II. Well, the reactions to this situation, in my opinion, will have to be both internal and external. Internally, much is expected of the reaction of American society in the streets, in public demonstrations, from the press, from the judiciary, and from Congress, maintaining the balance between those established powers and their ability to contain the obvious excess of the executive under Trump. At Fiocruz, we have been working hard to identify the damage caused here in Latin America and Brazil by Trump's stance in the White House and his orders to US government agencies. The damage is visible on health systems and scientific institutions in the health area, as I said before. by the new guidelines issued by the Oval Office, but also by HHS institutions under Robert Kennedy Jr., such as NIH, CDC, and FDA. We are also looking for alternatives. For technical cooperation in health research, we have accelerated cooperation with countries and institutions in Europe and with China. Fiocruz will open offices in Lisbon and Paris to facilitate relations with institutions in Europe, such as the Pasteur Institute in France. And starting this year, Fiocruz will preside over the Pasteur Network, which brings together Pasteur Institutes from around the world. It's an option to the support of NIH and the quality of scientists at NIH, US NIH. We also strengthen cooperation ties with Germany through the Robert Koch Institute and the Institute of Tropical Medicine, quite important institutions of research and development of mechanisms to face the emerging diseases. And we have received visits to strengthen relations with English institutions and with Belgian and Dutch institutions. We accompanied President Lula's recent visit to China, where the president of Fiocruz signed a cooperation agreement with the Chinese Academy of Sciences and the Beijing Genomics Institute. In public health, we will hold the conference of National Institutes of Public Health of the BRICS to strengthen ties in research on health systems and identify best practices in primary care, disease control, and other health disciplines and topics, using the structure and the presidency, the BRICS presidency in 2025 of Brazil. And in the BRICS, Fiocruz also participates in the Center for the Development of Vaccines, Medicines, and Diagnostics, putting together very important institutions from the 11 countries of BRICS, aiming to strengthen the capacity to respond to emerging diseases and prevention, preparation, and responses to pandemics. And also in BRICS, we suggested the creation of the Permanent Council of Health Ministers to closely monitor in detail the implementation of the agreed cooperation agreements. And at the next meeting of BRICS health ministers, to be held in Brasilia, capital of Brazil, before the World Health Assembly, the proposal to increase BRICS countries' contributions to the WHO will be discussed. Not to substitute the United States, for sure, because the United States should back to the WHO. This is the correct position. And as well as far as possible, replacing PEPFAR in some countries in critical situations if the US does not resume funding for HIV/AIDS, like in Mozambique. This is under consideration. In Latin America, we are proposing closer ties between the national public health institutes and between training centers for mid-level and high-level health professionals to improve health systems and address new emerging epidemic diseases. Again, trying to substitute CDC in this case. There is much more to say, which is being done to make up for the omissions promoted by the Trump administration in American institutions. In other words, to take this adversity in an opportunity. And we are very confident also that American society will oppose Mr. Trump's excess, including in the midterm election next year. It's our hope. And quite important, the reaction of the academic community in the United States to face this terrible position of Mr. Trump, and not only on public health and global health in general, but influencing the equilibrium between nations in the Occident and in the world in general. Thanks so much for hearing me.
I think you're muted, Sakiko, if you're speaking.
Thank you very much. It's now up to Sanya, who is speaking from Jakarta.
Thank you very much, and for including me in this. So a lot has been said already that I don't want to repeat. For those of you who don't know me, I'm a legal advisor at Third World Network, where I focus on the implications of trade agreements on health and so on in developing countries. I'm not from an NGO who has had its USAID grant frozen or cancelled, so I can't give, impacts from the ground. And I'm not from an NGO that's suing the Trump administration in the US courts, about USAID cancellation. So I can't give you the update about those cases and their likelihoods of success, but I'm happy to put you in touch with some of those people involved for other sessions. And as we heard, the context is that, the UK is also cutting their aid funding now from 0.5% of GNI to 0.3% to increase defence spending. The Netherlands has slashed 30% of their aid budget. Belgium cut its aid by 25%. France reduced its aid by 37%. Germany was planning to cut its aid. So presumably this trend will continue, especially if the Trump administration stops funding Ukraine's defence and more developed countries switch to funding that instead of spending money on aid. So I wanted to look at the impacts on developing country governments first, because that can affect then what CSOs advocate for, some effects on WHO and some then effects on CSOs. So, of course, as we heard earlier, some governments are very dependent on US aid to fund their health programs. For example, 89% of the Democratic Republic of Congo's HIV/AIDS medicines were funded by the US. So governments may be thinking of other ways to raise revenue. So, for example, in the UK, a parliamentarian suggested that governments should use digital services taxes instead. But we know that a Trump memorandum of 21 February this year is targeting countries who use digital services taxes. Some developing countries want to raise money via customs duties on electronic transmissions, so tariffs on downloading Netflix movies, and because the temporary moratorium on this at the World Trade Organization caused revenue loss in 2020 alone of $3.6 billion for Thailand, $2.6 billion for Mexico, $1.5 billion for India, and so on. But the Trump memo of 21 February also says they want to permanently ban the ability to impose customs duties on electronic transmissions. So then governments might turn to tariffs on physical products, imports of luxury products, like luxury cars. But then Trump's reciprocal trade and tariffs memo targets countries which impose tariffs on US products. Of course, tariffs are the easiest tax for developing countries and least developed countries to collect. You just stand at the border and say, pay me 10%. Compared to trying to collect an income tax or a value-added tax. So International Monetary Fund economists have said that if you have to cut your tariffs, for example, because otherwise Trump will penalize you with high tariffs on your products entering the US, for middle-income countries, at best they get back 45 to 60% of that lost tariff revenue. And for low-income countries, it's only 30%. So unless the health budget is ring-fenced, there'll be a further cut to the health budget from that kind of Trump action. So then countries might think, well, what about value-added tax? Because that at least applies equally to domestic products and imports. Surely that would be fine. But Trump's reciprocal trade and tariff memo targets countries which impose even a value-added tax on US products. So then governments may think, well, what about let's issue compulsory licenses on patented medicines so that they can make or import the cheaper generic versions since USAID is no longer funding it. Or maybe they don't even grant patents on medicines since the intellectual property rules at the WTO are strictly speaking not enforceable at the moment, while the US continues to block the appointment of appellate body members. So the appeals court is not functioning and you can't there cannot be a final decision against you for not complying with TRIPS, so you can't be punished, for example, with tariffs on your exports. Well, some developing countries have been pushed into joining the EU's optional multi-party interim appeal arbitration arrangement, which makes the WTO rules enforceable while the appellate body is not functioning, or those who might have intellectual property obligations in their free trade agreements can't, decide suddenly to not grant patents on medicines. And even then, Trump's reciprocal trade and tariffs memo from February this year targets countries for lack of intellectual property protection. And it's unclear if that means a failure to comply with WTO-level intellectual property obligations or a failure to give the US whatever even stronger intellectual property protection they might want, like 100-year patents on US medicines, medicines by a US company like Pfizer. So there might also be other more indirect implications on revenue, for example, for developing countries who collect corporate taxes, say, from their exporters who export to the US under unilateral preference programs like the Generalized System of Preferences or the African Growth and Opportunity Act. Presumably, Trump is wanting to end those because it is unilateral preferences. Only the US reduces tariffs on the developing country exports, and the developing country gets to keep their tariffs on US products. So what we see being suggested by some people in this crisis may actually not be very helpful. For example, some are suggesting a debt for nature swap, but this, can have low overall impacts on a country's debt sustainability, questionable environmental impacts, and distract from the real need to address the debt crisis. So then we got to the WHO. And the impact of US withdrawal on the WHO. It's actually my contacts who cover WHO, my colleagues, sorry, not me. So they could cover it in more detail. But briefly, what's happening in the WHO, of course, is that they're expecting a cut in financial flows, as the US withdraws, unless other countries step up to address the gap. So if the US is withdrawing from the negotiations, then that can be another reason for CSOs in developing countries to insist on legally binding commitments to deliver equitable access to health products and technologies and finance in the current WHO pandemic treaty negotiations. And I give an example here of a slight piece of good news is that I don't know if you remember when there was the bird flu crisis some years ago, countries, these kinds of diseases that cross from animals to humans usually happen in developing countries like Indonesia and Vietnam, where humans live close to their farm animals like chickens. And so what was happening in those days was Indonesia, for example, was sending the virus sample to the WHO, who was sending it to the big pharmaceutical companies who used the virus to develop the vaccine. You had to have the virus sample to develop the vaccine to match it. Then they patented it. Then they tried to sell it back to Indonesia for $20 a dose. You need $2 each, 22 doses each for the whole population, and Indonesia couldn't afford it. So Indonesia decided to stop sharing the viruses until they got benefits back. And as a result, the Pandemic Influenza Preparedness Framework, the PIP framework, was negotiated, which is actually a very smooth system, which means that virus samples, and in COVID we saw it just has to be the genetic sequence, doesn't actually have to be the actual virus sample, still gets transmitted to the WHO in a timely way so that vaccines can be developed. But in return, the big pharmaceutical companies give funding to the WHO. So for example, that PIP framework so far has already contributed $300 million to the WHO, which is used, for example, to build the labs and staff them that detected COVID. And it contributed 350 million doses of influenza vaccines in real time during a pandemic. But that only applies to pandemic influenza. So if we expanded that kind of framework to other diseases, whether it's COVID or other infectious diseases, that could be a source of revenue for the WHO that is not dependent on the US when they withdraw. So then we get to the impact on CSOs of this USAID cuts and so on. And I was actually at a digital rights conference last week with thousands of people from across the world. And of course, there are those like in the health sector who have lost USAID funding and now closing down. Then there, those who didn't lose USAID funding are now trying to take on the work of those who lost the funding. So the ripple effects are spreading. And then amongst those, then the NGOs are still competing even more for the remaining funding. And funding that, say, a South African NGO got from USAID that they then use to fund health programs in South Africa can't be passed on. So that South African NGO will now be violating their own subcontracts and so on because they're not receiving the funds from USAID. So it's causing all kinds of ripple effects and problems. And there's kind of broader meta level problems as well, because in a number of countries, NGOs were seen as foreign agents because they were receiving foreign funding. And so if those NGOs now close down because they no longer receive USAID funding, it kind of proves that they must have been foreign agents. And then we have the sensitive data of these health organizations and so on, which is now in the hands of the Department of Government Efficiency staff who have these rammed through security clearances and so on. So the responses that CSOs were talking about last week at this international conference was, can we look for funding from other sources? And people were suggesting, the former wives of Bezos and Bill Gates because they have money and they might be sympathetic. And we've heard lots of ideas from other speakers tonight. And as an NGO said at the conference last week, we can't afford to succumb to despair. Thanks.
Thank you so much, Sanya, and thank you to everybody for this incredibly rich array of information and comments that you've all made about the incredible kind of a ripple effect that this is having throughout global health, but very quickly a response that is filling the vacuums that are created, but at the same time, kind of like deep ways in which these responses are also being to some extent foreclosed by like what Sanya was sharing about the actions that limit the potential for on the trade front that offer opportunities for filling the gaps in financing and so forth. So just sort of like a incredible multiple of things. So audience, we do have about half an hour. So please put in your questions in the question and answer session. We already have a number of comments and questions. So we have one from Susan Erickson. So many of us have spent years working to improve global health, and this work included incisive critiques of the very organizations we may now be interested in helping survive. This is a paradox of this moment. Reinstituting the same global health system cannot be what happens next. How do we build back an improved system? So this is a very long-sighted view. Thank you, Susan. Does somebody want to take that now? Maybe Ali? Maybe you thought about this more than others.
Well, I really welcome the question. It's tough. It's something I think about every day. And I think about with colleagues, for example, at Partners in Health and students. As I said in my own remarks, we absolutely don't want to build back the structures that existed before. We do need to ameliorate, to mitigate the immediate suffering. And I think Joe pointed out many ways in which in the United States we can try to do that. But if we're not using this crisis to rethink the institutions of global health governance and how global health is financed, then it is a terrible, terrible tragedy. I've suggested some things. I think there are some structural campaigns that are not easy or short term, like I wrote in my blog about the UN Tax Convention of democratizing the way taxes are assessed across the world and taking it away from the club of donors in the OECD and putting it in the UN. The US will obviously not participate in that. It's just a question of how much it would decide to obstruct that process. I do believe that we need much more than debt for nature swaps and things. We really need, and more than tinkering around restructuring, although that is important, and I have worked on debt restructuring mechanisms, but we need massive debt cancellation at this point. Some of the IP stuff that Sanya said, there are possibilities for working on that collectively. Alternative research networks that Paulo pointed to are important. But things are moving incredibly quickly, and part of the point of Trump's policies is to create constant confusion and chaos, and we really need to just sort of get our footing and stand our ground. And the more kind of conversations and collective brainstorming we can do about how to respond in ways that don't reinstate or reify entrenched inequalities, I think is all to the good. I'm very eager to hear other people's opinions as well, because this is really tough.
Yeah, I think on this question of, how do we restructure global health moving forward in the long term is something that we'll come back to. Let me just say maybe we'll spend a couple of minutes on this some more. Other people might have a say on this, but the way I see it, there are questions of finance where there's an immediate gap being created, but then there's a question of restructuring that finance. From what sources? Do we depend on bilateral government contributions like PEPFAR, or do we depend on other mechanisms that are much more national government based, like collection of additional funding through, tax revenues, or do we? And then there's a category of just new sources of finance by these international reforms, like the tax in the areas of like tax and debt cancellation and so forth. So I'm just trying to map out these things, and that's on the finance front. So a new system, I'm just sort of thinking about new systems that's more sort of like less dependent. The dependence of global health finance, I think, is an area to be rethought, because currently it is over dependent on certain bilateral sources and let's not forget the philanthropies that are also part of the picture. The second thing has to do with the norm creation, the knowledge creation and the norm creation. And that again, what is a decolonial future in terms of more South-based norm creation? And a lot of what Paulo was talking about is tremendously important, I think, as a response. The middle powers, the emerging economies, as they're called, the global South leadership, what can they do to create new partnerships for? So that's in the area of decolonized knowledge production systems. And then there is the issue of the overall institutional infrastructure of global health, and what can we think of in terms of how we might head. So I wonder in that sort of like framing whether Joe, Paulo, and Sanya would have any comments. And I'll just take one because I want to move on to the other questions that have been raised as well. So anyone who has an urgent point to make on one of these issues, finance, norms, knowledge creation, institutional structures, what the future we might head towards, that is a more decolonized global health.
I would just say that I think conversations like this one are going to be increasingly important, and that today's conversation is not going to be an isolated one, right? That this conversation is something that is going to sustain itself in a number of different forms, by a number of different institutions, and beginning those kinds of conversations and sustaining them is what's going to lead us to a new place. And so I'm excited to see the collective be an institution that is starting that very much. But I think, as so many others on this panel mentioned, this isn't the only conversation happening, and I think that's exciting to see. We're just going to have to keep that conversation going.
So there is a comment in the Q&A. Felix Stein is saying someone has to fill in the financing gap vacuum left by the US, but Europe seems not want to do it. Should we hope for China or other players? Maybe Sanya or Paulo, do you have a view on this? Sanya.
I mean, I just briefly, my understanding is that some developing countries may not want to contribute to the WHO in larger amounts because they think that the WHO Secretariat would continue to follow European preferences. So they may prefer to do bilateral assistance. So I'm not sure that for many reasons, you can expect increased contributions from developing countries, and that might be one of them.
Yeah.
I
Paulo?
have to insist in the strategy will be designed by BRICS, because Brazil is president of BRICS in 2025, and we have a lot of meetings on health, and the summit of the presidents, the prime ministers, etc. My question is the role of this connection between Trump and Putin in BRICS, on BRICS. I think this is a very, very interesting question, because Trump is putting putting a lot of expectations in his relationship with Putin, and they are the same. They are the same because they are both autocrats, and they understand perfectly. They are interested in, but the question is the role of China in this geopolitics, because China is just waiting for the connect. What will be the result of this connection between Trump and Putin? Brazil and South Africa and the plus of BRICS like Egypt, Saudi Arabia, etc., are waiting for this situation will be clearer, because I don't know what is behind the scenario, the negotiations, the business between Mr. Trump and Mr. Putin. I really don't know.
Yeah.
And I think nobody knows.
Yeah.
But this is maybe the most important question in this geopolitics situation. And
Yes.
the whole of Europe, because, Europe will spend a lot of money in military, yes, because this and probably the industry of guns, etc., are very happy in Europe. So there are a terrible connection in the situation. I don't know about the industry of arms in the United States, because Trump withdraw to NATO. We don't know, but all these questions are in the future to be analyzed for the possibilities, and this is quite important to define, including the issue of global health, because the money will be to military expense and not to development and not to health. This is the main question. Just this comment up to now.
Thank you. Yeah, no, I think this is it makes me think that in thinking about the role of these different actors, we sort of have to think about the fact that everyone's priorities are changing, right? And when you refer to the Trump-Putin alignment, that's on geopolitics. And where does that leave health, global health, and the priorities that U.S. may have for global health, and the priorities that China may have for global health, and so on. China has been, I think, not as vocal on the normative issues in global health, but I do think that China has, of course, historical grounding in support for the G77. I mean, it does take these global South positions on, and they are very much behind, for example, the new impetus for the right to development, right? So that kind of a big normative reframing of of the world, I think is really quite, I think, an important issue important thing to think about in this sort of striving for a decolonial global health in the future. So let's move on to some of the other questions. I apologize that I'm not very savvy with the webinar format, so I don't know how it is that I'm allowed to ask. Can we give the microphone to people who are asking questions to ask themselves? Emma,
Yes.
can you help? Yes.
Yes,
So
probably you.
yeah, so Remco, I think maybe you could make your comment here. Emma, you can give him the facility to. Remco, you have a question you wanted to ask?
Hello, all. Do you hear me? Does this
Yes,
work?
yes.
Hello. Good seeing this panel. Remco van der Pas, United Nations University Institute for International Global Health, Kuala Lumpur. It's a wonderful discussion. The question I had is a bit related to developments, discussions on BRICS, public health cooperation there, as Paulo was mentioning. We see also for Indonesia and Malaysia, there's a turn vis-à-vis those institutions quite clearly. My question is a little bit about the new dependencies that might be created vis-à-vis autonomous or democratic sovereign space in global health and solidarity. Well, there was the original new international economic order thinking that was behind Alma-Ata, the UNCTAD proposals in the 70s. Progressive International and others are working on format for the 21st century. What would that mean for global health diplomacy? Is there momentum for something as progressive or decolonial, radical maybe, as this proposal? Is there space, or are we just moving to new dependencies? I would like to hear your assessment on this.
Yeah, that's a terrific question because I mean it's a follow-up to what we've been talking about, you know, a future of global health that would be based not on the dependent relationships. I mean, that seems to be a central question, right, as we move to the future.
I think no country has power, enough power to be the new colonialist, the new imperialist country. I think only the United States can have resources, have soft and hard power to be the new imperialist. China has a very different, at least in Latin America. China is the second most important country in the world in terms of global, not only global health, in terms of economics, and also using the soft power. They are very important for instance, in Africa. They have put a lot of money supporting African countries to start institutions or to develop institutions like the National Institutes of Health in Guinea-Bissau and other countries in Angola, etc. I mean, China has it's a very important player in geopolitics, in economics, and also in global health. But they have not enough resources in general and no motivation, in my opinion, to be the new imperialist country. I think this is the vision, the natural position of the United States, because they have this role since the Second World War, and Trump is trying to redesign this imperialism using the hard power and not only the soft power. But this will be tested. In the field of BRICS, I think that is not possible any country be the new imperial country, not for sure not Brazil, but for sure not China and not Russia. But I don't know the result. I insist in this vision. What does mean for BRICS, these connections between Trump and Putin? How Putin and Russia will influence the position of BRICS, considering that they are linked now to the United States by Trump, under Trump. I think this is the main question. Brazil is trying to be the president of BRICS and trying to be the force to have all countries, the position of all countries in consideration, and trying to connect with China and Brazil to be the most important connection inside BRICS. I think this is the strategy up to now. But we have day by day to decide, because I don't know about the Trump's tax on BRICS, for instance.
So,
he said 50%. He said 100% on BRICS if BRICS decided to have not the dollar as the currency in commerce.
Yeah.
But this is to be I don't know.
So Sanya, could you comment on how you see the role of China in global health moving forward? How do you feel just how have you been feeling their role in filling this vacuum, or not even? I mean, how do you read the role of China in global health?
So I have to say I'm probably not the most expert person to talk about this, including from our organization, but China's role in the area that I work on, say trade agreements, has not been consistently a developing country position. So, for example, in the Regional Comprehensive Economic Partnership Agreement, they were pushing for investor-to-state dispute settlement, which obviously restricts your ability to take health measures, say like compulsory licenses on medicines, and can result in huge payouts of billions of dollars, which reduces, your health budget unless it's ring-fenced. So I'm not sure that China will take an entirely developing country position. And then I was just thinking in this question of dependencies that there are things that governments and CSOs could do themselves to reduce dependencies. So, for example, governments could try and increase their tax revenue collection versus things that they need developed countries to agree to in order to solve this problem. So, for example, expanding the PIP framework to other diseases, that's something you have to negotiate and the rest of the WHO members have to sign on to and stuff. But even within those that developing countries can do for themselves, of course, if they could fund their own HIV/AIDS medicines by collecting enough revenue, presumably the Democratic Republic of Congo would be doing it already, right? And then we see that the Trump trade memos and executive orders are further reducing their avenues to be able to raise revenue to make up for the USAID shortfall. So, we can kind of categorize into buckets whether things are short-term, long-term, medium, whether they're things that governments can do for themselves or they rely on agreement from other countries. It's not easy to try and break these dependencies.
Yeah. Okay, so there is a question from Christoph da Costa. Would you like to ask your question? Is Christoph here? Well, I'll read it out. Yes, there he is.
Okay, so hello. Yeah, so it's Christoph from Institute of Tropical Medicine in Antwerp. And basically, I was actually wondering whether this global health crisis that we're seeing now isn't, well, as bad as it is, isn't just the next iteration in the ongoing poly crisis that seems to be accelerating. So I'm a bit wondering to what extent we can actually have this conversation separately from what is going on. The way I see it, for example, is that with okay, we might be thinking in terms of new geopolitical constellations, but it's very volatile. For example, in some countries you have leaders where you wonder whether in a few years there might not be somebody totally different with a different kind of mindset and so on. And even these people, even with all the changing geopolitics and increasing imperialism and so on again, you wonder to what extent they even have themselves control of the coming 10, 15 years. So I have major doubts that anybody at this stage can avert the coming mega crisis. So I'm a bit wondering, is there a way to have this conversation a bit in a more, well, of course it's easy to say in a more holistic way, but I'm a bit wondering to what extent we can have this global health crisis discussion separately from what's coming towards us, also with the planetary emergency. So I'm not sure I'm being clear, but that's a bit the point I wanted to make.
Yeah, thank you. Yeah, we are living in an age of uncertainty. So, but in a sense, I think it's helpful to think through both the short term, which is much more uncertain, but also the long term. And in a long term, such as, recreating a system that actually it is an opportunity to rethink and recreate a system that addresses some of the dysfunctions of the present, right? So thank you for that. Now we have a question from Anne Usher. Can Anne be given the microphone?
Hello, can you hear me?
Yes, yes.
Hi. I would like to direct my question to Alicia, maybe. I want to kind of bring it down to a little bit more concrete question. I'm hearing a tension in the comments between, on the one hand, this desperate need for stopgap measures to compensate for the sudden cuts in funding for things like AIDS medicine, for things like SRHR, you were talking about global gag rule and so on. And on the other hand, the more meta level arguments about fundamental rethinking of the global health architecture. And I want to bring it to the two big upcoming replenishments that we have, Gavi later this month and the Global Fund, which just announced its investment case at the G20. Just a few questions or any reflections that you have about these two big upcoming replenishments, which after all take a big chunk of the global health aid budgets. What do we know about what the US contributions to these two GHIs might be? If the US contributions drop to zero, as we might expect, given what's happening with the World Health Organization, USAID, and all the rest, should the other traditional donors be aiming to step up and fill the gap, even knowing that they're never going to be able to completely compensate for the US funding? And from the point of view of like Gavi and Global Fund, if they know that their budgets are going to be much lower than their asks, what should they be doing strategically now, in your opinion? Thank you.
Those are hard questions. So I do believe that the U.S. government is going to give very, very little or potentially nothing to the replenishments. I think there are alternative funders that may step in. I would think, for example, that the Gates Foundation would be particularly keen to step in on the Gavi replenishment. And I think the Global Fund, we should be pushing for other countries to step in there. But I don't think that's going to make up for US withdrawals. I think it's hard, and I hope this came across in my original statements. I think we have to keep these two things in our mind. Like, people are suffering and dying right now. And so we need to do something urgently about that. I work for a global health justice organization that does care delivery, Partners in Health. So that's, we can't just say, well, the system really was horrible and we need to just step back and remake it. We have to stem the suffering. But stopping there or doing it in a way that reaffirms the status quo ante is, I think, in my opinion, really a miscalculation and a missed opportunity. So not everybody can do everything. There are lots of people who work very, very actively on replenishment, as you well know. But those of us, sometimes academics, but sometimes very thoughtful policy people who are in the trenches, should be thinking, having these kinds of conversations and thinking more carefully about what kinds of global governance and financing institutions we should be pushing to move toward. And that's unclear because there's so much in chaos, as Paulo said, like it's just unclear how Russia is going to interact with the rest of BRICS or what China's role is exactly going to be. And so we're constantly needing to find our footing. But I think we need to stand our ground on certain principles. And I think, to go back to what Christoph said, if I may, just for a minute, Sakiko, we had been fighting previously, saying that business as usual is leading us off the cliff of climate catastrophe. And all of us really knew that the SDGs were not going to be met on health or climate or many other areas, that it was not a question of leave no one behind. It was people being systematically crushed, right? But we kept repeating the mantra. It was sort of a thing that global health did. And now I think Trump has, in his broad just denialism, absolute denialism of climate change and retraction, there's so many executive orders crushing the EPA, making sure that we don't have energy efficient vehicles, dismantling alternative energy, et cetera, that that effect and the view of climate and what that's going to do to health as well absolutely needs to be part of this broader rethink of the poly crisis.
Thank you very much. We've basically run out of time. We have just a few minutes left. So I want to just ask everybody on the panel to say their last words if they have if they wish. So let me move to Joe.
I would just say this is just beginning, and it's going to get worse. Just as we were sitting here, I was receiving an email or saw a post about Trump now cutting federal funding for universities that allow illegal protests or protests about issues that they don't like. So this is just beginning. Solidarity is the most important thing right now. And so let us continue to have conversations with one another.
Thank you. Paulo?
I think Paulo has lost the internet connection, so perhaps move on to another
Sanya,
one.
let me move to you then.
Nothing further to add. Thanks. Just grateful for all the help and support from around the world.
Yeah. I think this has been Paulo, you're back.
Yeah, just to thank you a lot for this conversation, Sakiko and Alicia. I think we have it's our strong obligation to discuss the question of global health in the context of geopolitics. It's impossible to discuss global health without discussing the political situation in the world and this terrible raise of the right side of the politicians, the conservative not only governments but movements in Europe, the danger of the situation in Germany and Austria, and for sure in the most important country of the world called the United States of America with this terrible president. And I hope this we have to continue discuss putting side to side global health and the geopolitics.
Yeah.
It's my proposal to our group to maintain the discussion, putting together these two dimensions because they are very, very, very connected.
Yeah, thank you very much. I think this has been a tremendously helpful, almost like an opening of conversations. I mean, in the Collective for Political Determinants of Health, it's a collective with people who are interested in the same issues and by and large share similar values about global equity in health. And so I think we need to keep the conversation going, and I hope we can organize follow-up discussions. And the way I read what you have all said, I mean, I think there are these issues of the short-term humanitarian kind of impulses, but then there is the longer-term question of where do we try to reconstruct an institutional normative infrastructure of global health that is more egalitarian and that is less dominated by the former colonial powers. And I think that also helps us think about both finance and norms and knowledge production, that in areas of norms and knowledge production, I think that's much more opportunity for all the countries, the non-US countries, the rest of the world, to step in and fill a vacuum and indeed kind of combat the hegemony of Western-centric, US-centric thinking and information, and have a more plural kind of a future. But in the area of finance, I think some of what you've all said, I mean, particularly Ali, about the need to remove the sort of the stranglehold that the global South countries find themselves, or many of them, particularly the low income, the countries of sub-Saharan Africa, find themselves in, that actually lead to reverse flows of resources on a macro scale, right? So, I mean, resources are actually being siphoned away. The capital flows north-south, and not north-south, it's south-north. And there has to be a way of adjusting that through international architecture of finance, right? It's not in the domain at all of global health governance, but it's in the domain of the governance of international financial architecture. But in the areas of norms and knowledge production, the vacuum that is being left by the US is actually, I think, maybe even quickly being filled by countries that are cooperating differently. But I also keep thinking that global health is not just about the low income countries and middle income countries and sort of the idea of the kind of like a poverty development agenda, but it is really about a collective problem that requires a collective solution. So I think we have to think about the new kind of direction that we would go in. Is it possible to have that kind of a new long-term direction without the US? So thank you so much, Alicia, Joe, Paulo, and Sanya, for joining this conversation. I apologize for my challenges with the internet, which has suddenly become very well, this has had this problem before, but anyway. I hope that we'll have more conversations like this, not just the speakers here, but all of you in the audience and in the collective as a whole. So thank you very much.